Good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your Wednesday. We are just a few short moments away from hearing from UAB Medicine as they give an update on the new drive-through COVID-19 vaccination sites that will be popping up across the Birmingham metro area. It appears that Dr. Sarah Nafzinger, who will be leading the Q&A, has approached the podium and will be sending you there live now.
That is reflected a year and a half, almost 2 years worth of tremendous amount of effort by our staff, and it's taken a tremendous toll on us. But we're happy to say that we're still here. We're still taking care of COVID patients and still here to serve our community. I would be remiss if I didn't acknowledge what a tremendous toll this has taken on our healthcare community. I know it's been a difficult task and a difficult journey for us. Our healthcare workers are tired, but they're still coming to work and still here to take care of you. So just want to give a nod to my coworkers and colleagues, not only at UAB Hospital, but at all the healthcare facilities in the state. I know they're exhausted and really counting on the community to help us out so that we can put this pandemic behind us. At the hospital right now, looking at data, we all like to talk about numbers and everybody says, well, where are we with things? Well, right now we do have a little bit of good news, and that's that the number of new cases has gone down a little bit and the number of new hospitalizations has gone down. So we're not seeing quite as many people come to our hospital who need to be hospitalized for COVID-19. So that's the good news. So overall, our COVID numbers are beginning to decline. Now, the bad news for us right now is what's going on in the hospital with the COVID patients that we do have. A lot of them are very critically ill, and we've seen an increase in patients who are requiring that critical illness support. So requiring ventilation, requiring other medications to support them. So very critically ill patients. A lot more than we had seen earlier in this surge. So that's the thing that's a little bit different for us right now and the current challenge that we're trying to manage in the hospital. So, what are some of the things that you might do to manage that surge in critically ill patients? Well, we're devoting more and more ICU beds to the care of COVID patients, which means those beds aren't available for other things like trauma, stroke, STEMI, to take care of patients who've had procedures. So, we still are providing those services, but have fewer beds to offer for those things. The other thing that we've done is, we've talked about several times before is we're not bringing patients in for procedures at a rate that we normally would. So people who may need a surgery or procedure for something that's very important and essential to their health, we're having to delay some of those things still. And so those are some of the things that we're doing to make extra room in our critical care units. And the other thing is a lot of times we're taking care of ICU patients in areas where we might not normally do that. So in our operation recovery rooms, we call them our PACUs, we're taking care of critically ill patients there. And critically ill patients are having to wait in our emergency departments longer and be cared for in those environments. So those are things we don't like to do, but we're doing what we have to do to take care of the need that's presenting right now to make sure that we can care for the patients who come to our hospital. So that's a snapshot of what's going on in the hospital right now. Overall, a little bit better, but we're still facing very significant challenges, and I don't want to minimize that, although we are hopeful because the hospitalizations and new case numbers are going down. Now, when you look at the new case numbers, there's one area where we are seeing an increase in cases, and that's in children. We're seeing the number of new cases each day in the pediatric population is continuing to increase. Well, that's no surprise because we know that the children started back to school recently. And so we anticipated that we would see an increase in cases in that age group as the children, play together and are together in schools. That's not surprising. What we don't know yet is how is that going to impact hospitalizations for adult patients. We know that they've seen increases in hospitalizations for children. We've heard that from our colleagues at Children's Hospital, and we've seen that in the statewide data. But what we don't know is how that's going to impact adults and their hospitalization rate. We're hopeful certainly that people who are vaccinated and people who continue to be careful and wear masks, with those things in place, that we won't impact hospitalizations tremendously for adults, but that remains to be seen. So that's the thing that really we're keeping an eye on very closely, and hoping that that increase in pediatric cases doesn't translate into another surge for adults. So that's where we are in the hospital right now. So I want to kind of switch gears and talk a little bit about vaccine and our vaccine sites. So a couple of announcements to make today. First is that UAB has chosen to go ahead and open some drive-through vaccine sites once again. These were popular a few months ago, and our demand had dwindled and vaccines widely available in the community, so we had closed those sites. But we've decided to go ahead and reopen them again in hopes that we can serve our community in that way. We're going to have 2 sites opening up, and I'll tell you the details about that in just a second. But first, I want to tell you why we're opening them up. First of all, we know that we only have about a 40% vaccination rate in Alabama right now, and that's simply not high enough. We know we have a lot more people who need to be vaccinated with their first dose, with their primary series, first and second dose of vaccine. So we want to make sure that we're available for people who maybe were waiting for that full FDA approval for the Pfizer product, or maybe who just wanted some more time to think about it, to discuss it with their primary care physician or their other family members. We wanted to make sure that we're available for those people to make it easy for them to get their vaccine if they've decided that now is the right time for them. We also know that we have a lot of patients who are now eligible for their 3rd dose of vaccine who fall into that category of severely immunocompromised. And we wanted to make sure that we're available for those patients in particular to have ease of access to the vaccine. We know that a lot of those individuals may have impaired ability to walk. Maybe they are wheelchair bound, or it's just difficult to get them out and about. So we wanted to make it as easy as possible for those individuals to receive their vaccine in a way that minimizes their exposures. So we just wanted to further, make ourselves available to provide vaccinations for people who are ready to get them. Now, the locations for these, there are 2 locations opening up. We opened up today at the Hoover Met, which you may be familiar with. We were there previously with a vaccine effort that went really well. We're very grateful to the mayor and the city of Hoover for hosting us at that site so that we can provide vaccine. And then the second site that's opening is at Faith Chapel, and that is located in the Wylam community. And we are very grateful to our host there for hosting us there. That's a new site for us, and we're very excited to partner with them and offer vaccinations at that location. So that will be opening up next week. We would have loved to open them up, both of them today, but frankly, limitation on the manpower. It takes a lot of work to open these sites, and so we could only do one at a time. So we got the Hoover site up and running because we were there previously, and it was a little bit easier for us to get that, and it took a little longer to work through the logistics for the new site at Faith Chapel, but it will be opening next week as well, and we're very excited to be able to offer vaccine there for our community members. So at that point, I'm going to go ahead and stop and be happy to take any questions.
All right, thank you, Dr. Nafziger. First question comes from Janae Pierre of WBHM. She's asking, or she says, we've been reporting the slight decline in hospitalizations as progress and good news for the state. But recently, Allaha says that the death rate has gone up, and that's contributed to hospital beds opening up. Do you have any insight into why maybe hospitalizations have slacked off?
That's a great question, and a lot of people can speculate about that. First, let me say, definitely we've seen a lot of people who have died from COVID. That's not something we tend to talk about a lot because it's unpleasant, to be honest with you. Hospitals, we don't like to talk about when we have patients who die. But unfortunately, patients are dying from COVID in our hospitals, despite our best efforts. Patients continue to die from COVID. And it's difficult to talk about, but that continues to happen. So we know that we have had some hospital beds open up because we have had a bump in deaths from COVID-19. Now, why are hospitalizations tapering off? I think it really is just tied to the number of new cases. The number of new cases in adults has dropped off over the past few weeks. And when we see that, every time we see it, we see a decrease in the number of new hospitalizations. So when you combine those two things, I think that really is what's driving the decrease in hospitalizations.
All right. Thank you. Dr. Nafziger, I know UAB was spending about close to $1.4 million a month previously when we had our 4 community vaccine sites running at the same time. Alan Collins would like to know if we have a figure yet on what we expect to spend this time.
You know, I was so pleased previously when we had opened our drive-through vaccine sites that we were able to offer that resource for the community. And when our finance department told me the dollar amount that we were spending on that per month, I was a little worried I was going to get in trouble with my bosses for that because it's a big number and it's a lot of money. But the nice thing is that, you know, I've said this before, they didn't blink. They said, that's okay. Keep doing this work because it's the right thing to do for the community. We know that our ticket to ending this pandemic is getting vaccines in arms. And so, you know, we haven't gotten a cost estimate yet for exactly how much the final price tag is going to be for us opening these vaccine sites again. But I was really met with the same response from our leadership team, and that's do what needs to be done. And if we really feel like this is the way we need to go right now to help keep our community safe, then this is what we're going to do, even if it is pretty costly. We know it's going to be expensive, but we're going to go ahead and do it because we want to make sure that we can provide vaccines for individuals who are ready to get them.
All right, thank you. Magdala with WVTM asks, will the Hoover Met and Faith Chapel sites be operating at the same time after the 22nd, and will we have enough staff to operate both sites?
You know, as far as the hours, I'm going to be honest with you, I'm not 100% sure about that. Adam may have information about that he gathered directly from the team, and I don't have those written down in front of me, so I'm not sure. But as far as the staffing goes, we do believe that we've been able to bring enough staff back to operate those sites. We had a lot of staff members who we were able to bring in for our vaccine sites previously. Many of them were retired healthcare providers who were happy to come back and work for short periods of time at the vaccine sites, but may not be ready to come back and work at the bedside or in other healthcare settings. So we did have a lot of individuals that we were able to bring back to help us work at those sites. And so I think we're in good shape right now for that. If that changes in the future, certainly we'll be letting the community know, and we'll be recruiting for other employees to help us with that. But for right now, we think we're good.
Thank you. I think her original question was, are they going to be operating at the same time? So will the Hoover site be operating while the Faith Chapel site is operating too?
Oh, yes. I apologize. I misunderstood. Yes, both sites will be operating simultaneously. So yes, on the same days. So absolutely they will be. And the point is that we want to be able to just be available for everyone. We would have loved to open them both today, but just logistically that was not possible for us.
Thank you. We'll go to Stephen Quinn, who has his hand raised. Stephen, go ahead.
Doctor, thank you for your time. A question I had for you, you mentioned and alluded to the fact that hospitalizations have gone down and that the number of new cases have gone down. There was a point, I remember in August, when we had the rise of the Delta variant where we worried about how bad this could get. One of your colleagues mentioned, potentially 5,000 people in the hospital. As we see those hospitalizations go down in this short window, do you feel like the worst of the Delta variant is behind us? Is there still more? Where do you think we're at right now in the terms of this spike, similar to what we saw, with the spike back in January?
I think that really is the million-dollar question. And oh my goodness, I really hope that we're on the downtrend with the Delta variant. This has been very stressful for the healthcare community. The thing that was different about this surge is how quickly we accelerated, just the rapid rise in new cases. was much more steep of an incline than we saw with previous surges. And that was in the face of a healthcare community that is already exhausted and just really tired of dealing with this. So this has been a tremendously difficult surge. I don't think we quite made to that 5,000 peak, and I'm so grateful for that. When people make these predictions and look at the predictive models, one thing that you can't account for is human behavior. And so that is why we sound the alarm when we see the predictive models say, hey, we're in trouble. There is a surge coming that is going to be crippling and bring us to our knees. And so that's why we've been sounding the alarm, asking people to, hey, please take your safety precautions seriously. Please mask, please get vaccinated. And so, a lot of that I think is the community listening and saying, okay, you know what, I do need to be more careful again. And maybe at times where people would have chosen to do an activity without a mask, maybe they're thinking twice and slipping that mask on. And maybe some people who are on the fence about getting vaccinated or getting vaccinated. I think that's probably why this peak didn't make it to 5,000 hospitalizations. I hope that's why. But for whatever reason, I'm extremely grateful that we didn't get quite that bad. Now, are we done with Delta yet? I don't know. The models that I've seen would suggest that we have peaked and we are on the good side of it. But what we don't know yet is the effect of all these pediatric new positives. And the question is, are these children then going to be at home with their parents, with their other caregivers around their grandparents, and pass that infection along? And is it going to lead to a second peak in Delta? And so we just don't know yet. I wish we did, but there are a lot of unknowns out there at this point in time. What we do know for sure, though, and I hate to sound like a broken record, what we do know for sure is that if we do the things we've learned to take care of ourselves and keep ourselves safe, we can make it safer for all of us to get on with our lives and do our daily activities. So those simple masking and getting people vaccinated are really the things that make a big difference so that we can do the things that we want to do.
Thank you. One question that was submitted, can anyone that is approved to receive the vaccine, so 12 years and older, receive them at our drive-through sites?
Absolutely. So our drive-through sites are happy to provide first, second, or third doses of the Pfizer vaccine product. And they've changed the name of it. Now it's called Comirnaty. But if you'll forgive me, I'm going to continue to call it Pfizer just because it's a little bit easier to pronounce. And I'm used to calling it that. And I think that's what the public's used to. So we're going to offer first, second, or third doses to those who are eligible. So this vaccine is approved for ages 12 and up. And so we are providing for ages 12 and up for that, for first and second doses. The third dose is only approved right now for people who have that moderate to severe immunocompromise. So this would be people who are perhaps on medications that might lower their immune system's ability to fight off infections, or may have other reasons that they have an altered or weakened immune system, other medical conditions. For example, people who are on chemotherapy for cancer, people who are on medications because they have an organ transplant, those types of things. So it's a very long list of people who would qualify, who would have those immunocompromising conditions. Now, the real question is, how do you figure out who that is? Well, the guidance we have been given is that patients should let us know if they fit into that category. We're not checking people's medical records. Nobody's going back and checking on that. So we ask people to self-attest. And so if a patient comes to us and says, yes, I qualify for this, then we're providing that third dose of vaccination. That's the guidance we've been given from the health department, and that's what we're doing. And I think that really is consistent across the community. I know I've talked to a lot of community pharmacists and others at different locations, and that seems to be consistently what's being done across the community.
All right, thank you. Next question is from WTVY. They say you mentioned the exhaustion of the healthcare community here in the Southeast. Here in Southeast Alabama, several hospitals are struggling with shortages and burnout. Is there a similar situation at UAB?
Absolutely. We've been saying throughout this pandemic, talking about how the pandemic has really taken a toll on our healthcare workers. And I think a lot of the healthcare workers really feel like the rest of the world is going on like normal while we are continuing to suffer. And I really hate that. I feel like our healthcare workers are under a tremendous amount of strain. I hear that from them every day. I see it in their eyes, and we just continue to lift one another up and encourage one another. But, I'm here to tell you right now that your healthcare workers, if you know one, reach out to them, support them, because we're going through a very difficult time right now. This is absolutely exhausting to continue to care for wave after wave of patients who are critically ill with COVID-19, especially when we know that the large part of what we're seeing right now is completely preventable. We have a vaccine that is safe and effective, and it's very good at keeping people from becoming critically ill with COVID-19. It's very good at keeping people from dying from COVID-19. So I think in our healthcare community, we're really frustrated because we wish people would make that choice to go ahead and be vaccinated so that we can put this pandemic behind us. So yes, absolutely, seeing staffing shortages, seeing our staff who's very exhausted, and we're trying to support them in every way possible. But, I think that would be my plea to the community is, number one, how can you support us? Number one is by getting your vaccine. And number two, if you know a healthcare worker, if you love a healthcare worker, reach out to them and let them know you appreciate them because they're really working hard.
Okay, thank you. Next question is from Eddie Burkhalter. He says, this week the federal government began limiting the shipment of monoclonal antibody treatment drugs to some states, including Alabama. Is there any concern about either the drug's availability or the public relying too heavily on that rather than vaccines?
In Alabama, especially at UAB, we've been very grateful to continue to receive monoclonal antibody shipments. We know that those are one of the more effective tools we have if patients do become infected with COVID-19 to treat them. It helps prevent hospitalization and severe disease when we use them. Now, some of the monoclonal antibody treatments, as time has progressed and the vaccine, the virus has changed with the different variants, we've learned that different formulations of the monoclonal antibodies are more effective than others. But right now, at this point, we have good supplies of monoclonal antibody treatments at UAB. And I believe in our state, based on what I'm hearing from others in the healthcare community. Now, there's ongoing dialogue between us, hospitals, the Hospital Association, and the governmental entities that will be distributing those about how the decisions will be made about how much antibody treatment goes to different facilities and how they'll be allocated. Right now, I don't see any cause for alarm, but definitely there's an ongoing dialogue, and we're continuing to work with them every day to submit information, which basically lets them know how much we need and of what type. And they've been working to provide those to us. So right now, I don't see any cause for alarm. Trust me that if I do see cause for alarm, I'll be one of the first people you hear from who will be raising an alarm that, hey, we're not getting what we need to take care of the patients.
All right, thank you. Next question is from Ashley Carter. Ashley?
Yes, hi. I'm Ashley with Wade TV. Kaiser study came out that revealed that the cost for hospitals for treating unvaccinated patients is in the billions within the past 3 months. How is the amount of unvaccinated patients in UAB affecting hospital operations, if any way?
I think the thing that is so frustrating for us in healthcare is that 90% of the patients who we're seeing admitted to our hospitals, and it varies, sometimes it's 85%, sometimes it's 95%, but somewhere around 90% of the patients who are admitted to the hospital with COVID-19 infection are people who have chosen to not be vaccinated. And I think that's very frustrating for us because we know that it's preventable. And likewise, the surge of COVID-19 patients who are admitted to the hospital are putting a strain on our resources in every way. We're devoting a tremendous number of beds to caring for those patients. And when we talk about a hospital bed, what that means to us as a healthcare worker, it's not just about the physical bed that they lay on, it's all the people and all the other resources dedicated to caring for the patient in that bed. So it's doctors, it's nurses, it's respiratory therapists, it's physical therapists, it's environmental services, it's food nutrition workers, it's medications, it's pumps, it's supplies, it's needles and syringes and gloves. It's all those things that go into caring for that person who's in that bed. So we know that this tremendous bump in COVID-19 positive patients has put a tremendous strain on all the hospitals in Alabama. And it's caused us to not have resources to care for the things that we normally would be doing. So we've had to delay things. We've had to delay surgical procedures and other types of interventions for things that need care. These are not things that are luxuries. These are things that are essential to people's health. And we've had to delay them. And we're not happy about that. I know at UAB Hospital, we've had to decline transfer requests for patients who normally we would accept at UAB and be able to help them. And we've not been able to accept them because we haven't had bed availability. And that goes for patients who are infected with COVID-19, as well as patients with other conditions. For example, we've had some calls this summer for patients with snake bites. And normally we always accept those transfers. And it was transfer requests that we were not able to accept because we just didn't have the capacity. We didn't have the beds available to care for those patients. So, we try to help and do consultation and help manage over the phone, but it's just absolutely heartbreaking to our clinicians. And I'll tell you, I've had physicians call me in tears over it. We're absolutely heartbroken. I've had nursing staff and others call me just, they're absolutely heartbroken because we want to care for these patients. So, I'm sorry, I got a little long-winded there in my answer, but in summary, yes, COVID-19, the surge has put a tremendous strain on our healthcare system. It's driven largely by people who have chosen to not receive the vaccine. So it's terribly frustrating for us, but we're doing the best we can to manage it because at the end of the day, we're here to care for everyone. So regardless of whether or not you chose to get vaccinated, we're here to take care of you. We've promised that we're going to do that. And we're going to deliver on that promise. But yes, it is very frustrating for us right now, and it is limiting our capability to do the things that we normally would like to do.
All right, thank you. One question that we received is, should those that receive the Moderna and Johnson & Johnson vaccine get the Pfizer boosters at this time?
So that's a great question. So at this point in time, we don't have any recommendation for second or third doses on the Johnson & Johnson vaccine. So there's nothing, no recommendation from the FDA or the CDC about people who receive their initial vaccination with the Johnson & Johnson product. And now we do have a recommendation for people who have received the mRNA-based products, and that's the Moderna and the Pfizer vaccines. So we do have that recommendation for the third dose for that group of people who have immune compromise for the Moderna and Pfizer vaccines. They also recommend, if you received your first 2 shots of Moderna, they prefer for you to get Moderna for your third dose. Same with Pfizer. If you receive the Pfizer vaccine for your first 2 doses, they prefer for you to get your third dose with Pfizer. So that's the recommendation from the FDA and from the CDC. We don't know if that will be expanded to other groups. And I think, that's the hot topic right now that everybody wants to talk about. Well, what about me? Should I go get it? Do I need a third dose? And that's something that's being studied very closely. I know there's been a lot of confusion about that topic because The Department of Health and Human Services had mentioned that they thought that would happen around September 20th. But all I can tell you is what I know for sure. I know that the FDA is meeting again on September 17th, which I believe is this Friday, to talk about this very topic. And right now, we don't have a recommendation for a third dose for any other group. If we do receive that guidance, certainly we're going to comply with that. We're going to be ready to supply those doses. But right now, the only guidance we have is for people who fall into that category of immune compromise to receive their third dose.
All right, thank you. I don't see any other questions, so I think we will go ahead and wrap things up. Just a reminder that those interested in getting their vaccine can go to uabmedicinevaccine.org, or they can call 205-975-1881. And I don't think we mentioned this at the top of the briefing, but you can schedule an appointment at the Hoover and Wylam locations, but they're also accepting those who do not have appointments. So if you could share that information with your viewers, that would be helpful. Thank you so much, Dr. Nafziger, for your time today, and have a good day, everyone.
Thanks.
And welcome back to CBS 42 Now. We just heard from Dr. Sarah Nafziger with UAB Medicine as they discussed lots going on, everything going on regarding the coronavirus pandemic, as well as their 2 new drive-through COVID-19 vaccination sites that they are opening up. They are opening one in Hoover and Wylam. The Wylam location will be opening up later next week, with the Hoover one already being up and running. Again, you can make appointments at those locations over on UAB's website, and they are also accepting walk-in, or I guess drive-in appointments as well. Again, we will have all that information for you over on our website, cbs42.com, in just a matter of moments. We want to thank you all for tuning in to this latest edition of CBS 42 Now. I'm Phil Pinarski, and we hope you have a great rest of your day.